How many times have you touched your face in the last hour? Did you know that 80% of all infectious diseases are transmitted by touch? That is cited from Jay Hardy, who is the CEO of Hardy Diagnostics. As a healthcare provider, I see firsthand the importance of hand washing. We wash our hands when we enter and exit patient rooms, before and after dressing changes, before helping patients with their meals, and the countless times that we remove our gloves throughout the day. We do this not only to protect ourselves, but also to protect the patients. We've all been infected with the common cold at some time in our lives, me currently. And think about all of the different organisms that we come in contact with on a daily basis. We stop at our local coffee shop in the morning. You touch the door when you go in. You use the keypad or the pen pad to pay, or use cash. And you touch the door on the way out. Think of all of the people that have touched those exact items before you and all the germs that are lurking there. Today, I would like to persuade you to wash your hands a little more often. There are so many benefits to your health, to the people around you, their health, and besides, your hands are disgustingly filthy. So let's talk about how you can benefit from a little more soap and water. Washing your hands is one of the best defenses against infection and disease. Germs enter the body through mucous membranes such as the nose, the eyes, and the mouth. Washing your hands before you eat or prepare your food prevents you from ingesting those germs. You should also wash your hands before touching your face and eyes, for example, putting in contact lenses. Tiny breaks in the skin are also an entry site for germs. So after you wash your hands, you want to make sure that you use some type of lotion on your hands to prevent that. Also, this is another good reason to stop biting your nails. You're eating all those little germs. Some healthcare providers actually believe that excessive hand washing can cause an increase in superbugs or antibiotic-resistant bacteria. Samer Blackman, MD, a specialist at Piedmont Healthcare, has concerns that eliminating bacteria that helps build the immune system allows antibiotic-resistant bugs to enter the system. There's concern that people are developing a weakened immune system from the increased use of hand sanitizers. On the contrary, the Center for Disease Control actually states that preventing sickness reduces the amount of antibiotics people use and the likelihood that antibiotic resistance will develop. Many scientists and physicians conclude that resistant bacteria is caused by the overprescribing of antibiotics. Also, courses of antibiotics are not completed by the patients, and thus the bacteria build up a resistance. So what this means is a decrease in illness by washing your hands would equal a decrease in the use of antibiotics, which would mean a decrease in the spread of superbugs and the development of superbugs. Some of the most common resistant bacteria are MRSA, which is a methicillin-resistant staph, VRE, which is vancomycin-resistant, ESBL, which is an extended spectrum beta-lactamase, and C. diff, which is Clostridium difficile. All of these bacteria are highly contagious, and at the hospital these patients are placed on isolation, which means that we wear gown and gloves and strict hand washing with soap and water when we enter and exit the rooms. The Center for Disease Control recommends that proper hand washing technique is 20 seconds with soap and water, clean water. 20 seconds is the length of the Happy Birthday song sung twice, and also the length of the Yankee Doodle Dandy from start to finish, according to Jay Hardy. So 20 seconds doesn't seem very long to prevent yourself and to prevent others from being infected. It's important to keep those germs that you do have to yourself. Hand washing is essential in preventing the spread of infection to others. When you're sick, you should wash your hands more often. You should not only wash your hands when they're visibly soiled, you should wash them after sneezing, blowing your nose, coughing. Other people may have contact with the objects that you've handled and become sick from the germs that you've left behind. As stated by Jay Hardy, 95% of the population states that they wash their hands after using the toilet. However, when 8,000 people were monitored across 5 large cities in the U.S., they found the number to be more like 67%. Now that's pretty gross. Tiny microscopic E. coli poop particles are being dropped off on unsuspecting items from all of your dirty little hands. It's disgusting to think that when you pick up the GI bug, it's because you may have inadvertently ingested particles of someone else's poop. Think about that. Now, if that doesn't make me just want to go wash my hands right now, I don't know what does. Washing your hands also protects those around you, people that may be immunocompromised and not able to fight infections on their own. People who are perhaps undergoing chemotherapy for cancer, certain immunosuppressant medications that are prescribed for lupus, rheumatoid arthritis, AIDS, HIV, other autoimmune and immune disorders can lower the body's ability to fight infection. Also, organ transplant patients take anti-rejection drugs, and this increases their risk of infection. So, by washing your hands, you could be preventing something that could be deadly to these patients. Have you ever thought about the different germs that you actually do carry around on your hands? There are so many different bacteria and viruses that can cause illness, and how they spread may surprise you. The CDC states that feces or poop from animal or people is an important source of germs like Salmonella, E. coli, and norovirus. These germs can be spread or transmitted from contact with contaminated surfaces, from hands that were not washed after using the toilet, handling raw meat, ingesting meat that's not properly cooked, and also drinking contaminated water. Some of the symptoms of these illnesses are nausea, vomiting, abdominal pain, diarrhea, and in severe cases, bloody stools. The influenza virus and the common cold are also transmitted by droplets, so droplets that are spread in the air by coughing and sneezing. According to MaxShield, we also carry other germs on our body, like streptococci, which causes sore throat, Pseudomonas, which causes infection of the wounds, Staphylococcus, which causes boils and zits, Shigella, which causes diarrhea, Streptococcus pneumonia, which causes pneumonia, and also E. coli, which causes diarrhea and often vomiting. We know that there are germy things that we touch all the time. Some of the things we definitely know about are money, gas pumps, toilet seats. We all know that those harbor bacteria and germs, but some other hiding places may just surprise you. According to LifeBridge Health, computer keyboards, cell phones, and carpet are germier than the average toilet seat. Even worse, kitchen sponges are 200,000 times germier. So think about that before you use that sponge to clean your dishes. Other common places that harbor illnesses causing bacteria and viruses are vacuum cleaner brushes, ATMs, shopping cart handles, and restaurant menus. The nice thing about the shopping carts is a lot of grocery stores now have the hand wipes in there so you can clean those off. LifeBridge Health also states that E. coli can live on surfaces for 16 months. MRSA, or MRSA, can live 7 months on surfaces, hepatitis B for 1 week, and the common cold virus for 3 days. That's a long time. It's clear to me, and it should be clear to you now, to see the benefits of washing your hands and the importance of frequent hand washing. It all starts with you and a 20-second simple hand washing. Sometimes the little things we do make the biggest difference. Hand washing is one of the most important things that each one of us can do to keep ourselves healthy, prevent others from getting sick, and just because you can't see the germs doesn't mean that they aren't there. You can be your own best defense against getting that GI bug this year. You can prevent the lady behind you in line at the grocery store from catching your cold. Did I mention she's in her third cycle of chemotherapy for stage 4 lung cancer? You're not just preventing illness. You may just be saving a life. Please wash your hands.